Bonjour, good morning. Je suis Anne Lagacé-Dawson de la Coalition canadienne de la santé, and we've gathered here to launch our biggest ever citizen lobby of parliamentarians fighting for public universal health care. There are 200 citizen lobbyists waiting to meet parliamentarians. They're not corporate or business lobbyists. They are representatives of the population of Canada, frontline healthcare workers, civil society groups, researchers, and regular Canadians who care deeply about Canada's most beloved social program, universal public health care. And we're here to speak on behalf of those people. So today's speakers represent citizen lobbyists from across the country, from every province and territory. And we're here to speak for our fellow citizens and Canadians in the face of threats emanating from private sources and from across the border directed at our healthcare system. Our first speaker will be Jason McLean. He is the chair of the Canadian Health Coalition, and he's here from Nova Scotia. Jason?
Bonjour and good morning, and happy Black History Month. The Canadian Health Coalition represents more than 3 million people. We're frontline healthcare workers, researchers, and civil society groups. Our coalition was founded in 1979 by Tommy Douglas to protect and advance universal public health care. And I dare say that we represent the majority of Canadians who rely on our public health care system every day. More than 200 citizens, lobbyists from every province and territory have come to Ottawa to meet with 100 parliamentarians on Parliament Hill over the next 2 days. And it's about the critical importance of healthcare in the midst of inflation, crisis, and attacks from the Trump administration. And I wish it was all a celebration of democracy in the next 2 days. But we've been taken aback and even disappointed that the health policymakers in Minister Marjorie Michel's office have repeatedly declined to meet with us. Meanwhile, the Canadian Life and Health Insurance Association and the insurance industry has lobbied top Liberal government officials, MPs, and senators 53 times about pharmacare since the April 28th election. We know from the lobby registry that policymakers in Health Canada have met with big insurance, but apparently the minister and staff do not want to hear from us at all. Well, I call that unfair and un-Canadian. Canada is not just pipelines, logging, and mines. Canada Strong is healthy people who get the care they need when they need it, regardless of location or ability to pay. The federal government needs to step up and defend universal public health care now. Alberta's Bill 11 is the most open and direct attack on the health care that we've ever seen. Alberta wants to create a private health insurance market and drive up costs like in the U.S. Bill 11 will increase wait times in public sector, and it opens the door to hospital user fees. It is truly a disaster for public health care. Bill 11 ignores the universality and accessibility principles of the Canada Health Act, and that means Alberta's federal funding should be called into question. If Danielle Smith and the UCP violate the Canada Health Act, they should get less money from the federal government via the Canada Health Transfers. For those who don't know about the Canada Health Act, it was passed unanimously in 1984, spearheaded by Liberal MP from St. Michel, Health Minister Monique Bégin. Bégin, who died in 2023, came to Canada as a refugee after World War II. She knew all too well the suffering caused by not being able to afford health care growing up poor in the NDG neighborhood of Montreal. The Canada Health Act is short and very clear: to protect, promote, and restore the physical and mental well-being of residents of Canada and to facilitate the reasonable access to health care without financial or other barriers. In closing, we think it is only reasonable and fair to be able to meet with the Health Minister, Marjorie Michel, to discuss these issues. It's time to build Canada strong and enforce the law of the land, the Canada Health Act. Thank you.
Thanks, Jason. I'm Chris Galloway. I'm the Executive Director at Friends of Medicare in Alberta. We were actually formed in 1979 around growing concerns about extra billing, and that led to the creation of the Canada Health Act in 1984, which Jason mentioned, that passed unanimously here in the House of Commons. And that's an important reminder that Canadian Medicare has always been a federal-provincial partnership. But we're in Ottawa this week because our public health care is more at risk than it has ever been. We face an existential threat, and that threat is in my home province of Alberta with the passing of Bill 11. Bill 11 brings two-tier American-style healthcare to Alberta. It'll mean that Albertans will experience a system where those who have money will be able to pay to access quicker care, and the rest of us will be left waiting longer or going without. We think that's unacceptable, and it is a clear violation of the Canada Health Act. But Bill 11 is more nefarious than just that. It is also a gift to the private insurance industry, who've been working hand in hand with the Alberta government to make it happen, allowing for the insurance of medically necessary services already covered by our public health plan, and allowing potentially American healthcare companies into Canada, getting a foothold in Alberta, potentially undermining our protections for single-payer healthcare in our trade agreements with the United States and elsewhere. It's urgent that the federal government act on this. We've written to the federal minister, to the government. I know organizations across the country have. Thousands of Albertans and Canadians have written in calling for action, and yet we've had months where the federal government has not taken a stance on what's happening in Alberta. They have not spoken up. And so we're here today, and we're here this week in Ottawa to call on the federal government to do their job, for Mark Carney and his government to speak up, to enforce the Canada Health Act, and to step up to protect our treasured public health care before it is too late.
Bonjour à toutes et à tous. Merci d'être ici aujourd'hui sous la colline parlementaire pour défendre notre système public de santé et de services sociaux. Je m'appelle Sébastien Pitre, je suis intervenant en centre jeunesse de formation et trésorier à l'Alliance du personnel professionnel et technique de la santé et des services sociaux, l'APTS. Nous représentons plus de 68 000 personnes qui travaillent partout au Québec. Ce que nous vivons au Québec doit servir d'avertissement parce que la privatisation s'installe tranquillement, petit à petit, dans le quotidien, dans l'organisation du travail, dans des décisions qui semblent temporaires, mais qui finissent par changer le système au complet. Et au Québec, on le constate de façon très concrète, notamment sur les plateaux techniques. On parle de services essentiels comme les prélèvements, la pathologie, les laboratoires, l'imagerie médicale. On voit une multiplication des achats de services auprès de cliniques privées. On voit même le développement de services privés dans des secteurs auparavant offerts par le réseau public, comme certaines activités d'imagerie et de médecine nucléaire. Au Québec, entre 2014 et 2024, l'appel à la main-d'œuvre indépendante a augmenté de 447 %. Les achats de services et de soins dans le secteur privé ont augmenté de 106 %. Résultat, une facture de près de 5 milliards de dollars en 2024. 5 milliards, ce n'est pas magique, c'est de l'argent des contribuables. Ce n'est pas normal, ce n'est pas inévitable, c'est un choix politique et on ne devrait pas accepter ça. Nous sommes ici aujourd'hui parce que nous voulons un système de santé publique fort, pas un système où le public finance le privé, pas un système où l'État paie des marges de profit de compagnies privées avec l'argent des contribuables. La santé, ce n'est pas une marchandise et nous avons des solutions. D'abord, il faut sortir le privé de la santé et des services sociaux. Il faut rapatrier progressivement dans le réseau public les services qui ont été transférés au privé. Il faut réduire radicalement les dépenses en main-d'œuvre indépendante. Mais il y a un autre enjeu majeur dont on doit parler aujourd'hui ici à Ottawa, l'accès aux médicaments. Au Québec, on vit dans un système hybride. La population est protégée en partie, oui, mais la réalité, c'est que la majorité des travailleuses et travailleurs doivent obligatoirement adhérer à une assurance médicaments privée via leur employeur. Et ce modèle-là coûte extrêmement cher. C'est pourquoi nous demandons la mise en place d'un régime public universel d'assurance médicaments. Un régime universel permettrait de corriger les iniquités entre le public et le privé et nous permettrait de nous libérer de l'emprise du Big Pharma et d'un système où la santé devient un produit rentable. Une étude publiée en 2017 estimait que pour le Québec seulement, un régime public universel pourrait générer jusqu'à 3,8 milliards de dollars. Imaginez ce qu'on pourrait faire avec cet argent dans le réseau public. On ne peut pas défendre un système public sans défendre celles et ceux qui le font fonctionner. Et aujourd'hui, la crise de la main-d'œuvre en santé est partout, mais cette crise n'est pas seulement une question de chiffres, c'est également une question de conditions de travail. C'est une question de surcharge, d'épuisement, de manque de reconnaissance. En tant qu'intervenant en centre jeunesse, je peux vous dire une chose, quand le système craque, ce sont tous les mêmes qui écopent. Les personnes vulnérables, les familles en détresse, les gens qui n'ont pas les moyens de payer, les enfants, les personnes en crise. Et ce sont aussi les travailleuses et travailleurs du réseau qui portent ça sur leurs épaules jour après jour. Nous sommes ici pour dire clairement aux membres du gouvernement fédéral, vous avez un rôle à jouer. Vous devez faire respecter la loi sur la santé. Vous devez agir quand des provinces s'éloignent des principes fondamentaux du système public. Et vous devez investir dans la main-d'œuvre, pas seulement avec des annonces, mais avec une vision claire, durable et structurante. Merci.
Good morning, everyone. My name is Pam Parks. I am a proud registered practical nurse. I've been a nurse since 1986 in Durham, Oshawa area, and I worked in the Emerge department. I just want to thank the Canadian Health Coalition for inviting me here today so that I can bring words in regards to my 3,500 members that I represent as the QP president at my local. Before I start, I just want to give you a brief outlook of what it looks like when you walk into emergency for our typical overflowing when the ambulance bring in our patients into the hospital. They're lucky enough if they have room to go inside so that they can actually have a bed for them to reassess for the doctor and the nurses to look at. Unfortunately, that's not so. They're held out in the ambulance bay. Today, like a day like today, can you imagine that? And once they actually ventured in through the doors of our emergency, they are lucky enough if they get a stretcher, or we have to treat them in chairs in the hallway. When the Ford government first came into power, he announces that all-way medicine would be gone. I can tell you as a proud nurse at the hospital, that's not so. People are housed in hallways. Now they got a little bit smarter. They removed some of the patients from the hallway and they merge where the eyes can see it, and they put them up to the units where patients are admitted in the hallway. Just imagine if one of your loved ones came to the hospital and they need care.
Greg, we need to talk.
No time, got sales calls to summarize.
You really need to switch to Monday CRM. It has
And they're out in the hallway. There's no privacy. There's no dignity. There's no, their morale is completely gone. As a nurse myself, I feel so ashamed that this is what our healthcare system has come to, because it's been defunded and not given the funding that they need. I'm talking here as a frontline worker. I'm bringing what is actually happening in our healthcare system. You see day in, day out, where our loved one comes into the hospital as nurses, clerks, PSW, name the frontline workers, doctors included. We are trying our best. We miss our breaks. Sometimes we don't even remember if we ate or not, or go to just have a 5-minute downtime because you have to look after these individuals that needs our support. Go home in the daytime when you finish your 12-hour shifts, and you're crying in the car because you know you have not give the care that you actually need for your patients. I've been a nurse since 1986. Things were bad. When COVID hit us, we thought, oh, they're listening to us. They're preaching on the TV, those frontline heroes. Well, they soon forget after COVID ended that we were still there. Things got 10 times worse. I can tell you if when the Ford government, he came to Lake Ridge twice that I know of, and they come in behind the screen. You don't know they're there till after they leave. He said that he would like to listen to frontline workers, but when they visit the hospital, they do not even announce that they're coming. Why is that? Because they don't want to hear from us. If he wanted to hear from us, or any government wanted to hear from their frontline staff, they would hear from us that privatization is not the solution. You need to put funding, public funding, in hospitals, not to the private clinics. Frontline staff and the patients that comes into our hospital do not need privatization. They need the funding so that you can staff it properly, so that the nurses and all the other allied health can look after them when they get in there. Just imagine if that's your loved one that comes in the door. I imagine that every day when I walked in, that could be my mom, my son, my husband, my neighbor, and I looked after them to the best of my ability. But we need the tools as frontline workers. We are pleading, we're begging. No one is listening. Our employers hiding behind the government. They don't step up. When they get the funding that they get, which is not enough, they decided that they're going to squander it with hiring more bosses. We don't need more bosses. We need frontline dollars in public health care for the staff that are there looking after your loved ones out there. To the Prime Minister, the government of the day, just remember, because you have money, it doesn't mean that you should jump the line. Every one of us need health care. Health care is there. If you don't have your health, you do not have anything. And I'm telling you, as speaking for frontline workers and the citizens of the country, we need to do better. The government needs to do better. And when you get in there, you need to look after your frontline workers, because the building is brick and mortar, but there's lives, there's human beings that we look after. We're not looking after factories. We're there looking after the health of citizens, and that could be any one of us, any one of us. We need health care, we need the funding, we need to keep it in the public sector. And on behalf of my members, I would say I hope someone is listening, and when you do visit a healthcare facility, long-term care, wherever healthcare, come talk to us. We would like to tell you the real story. Thank you very much.
Thank you, Pam. I'll be really quick. My name is Natalie Mara. I'm the Executive Director of the Ontario Health Coalition, and like Chris described, in Alberta, we were formed in the late 1970s and actually held the hearings that helped to create the Canada Health Act in the first place. Objectively, healthcare in Canada is in very grave danger. In fact, I've done this for 26 years now. It's the worst that I've seen it in my career, by far. Historically, when things got this bad, the federal government would name a royal commission to actually put an end to the threats to public health care. That's how the Canada Health Act was born. We had the Romano Commission. Things at this point are worse than they were even leading into the Romano Commission. They are akin to what they were leading into the Canada Health Act. The threat that Alberta's Bill 11 poses, it's not just a threat, it's a direct assault on the Canada Health Act. The legislation contravenes the Canada Health Act in every fundamental way. And, you know, the Danielle Smith government, Danielle Smith herself was an intern with the Fraser Institute. There is an ideological drive here to dismantle public Medicare as a national project in this country. And it is fully in swing right now. And if we do not stand up for public Medicare now, if this federal government does not find some strength and stand up for public Medicare, we're going to lose it in Canada. Outside of Alberta, in Ontario, Patients who go to the private clinics are being charged outright for cataract surgeries. That's mostly where privatization has moved in here. In BC, patients being charged for MRIs. In Alberta, they're being charged for surgeries and diagnostic tests. In Quebec, for access to primary care. Even on the East Coast in the largest cities where the private clinics have moved in, patients are being charged for health care. It is objectively the worst it's ever been. We need the federal government to not just meet with a for-profit insurance industry, we need them to meet with the defenders of public Medicare, who are millions across this province. I represent 1 million Ontarians, and we will not stop. We will not allow them to take away our public health care. Nobody has a mandate to do this. So to the Carney government, the economy is not just pipelines and ports. Canadian sovereignty has to mean something. And the values that underlie our society, fundamental to them, is that we take care of each other. It's that judge and janitor have access to the same health care on equal terms and conditions, regardless of their wealth, regardless of where they are in the country. That is part of what makes us Canadian. It's fundamental. And this government cannot continue to be so weak on this. Thank you.
Here. So I don't know if there are any questions?
We are going to forward other questions here. If you have any thoughts, opinions, and so forth, leave them in the chat. We will look at them. We do follow up on that stuff. Don't forget to like, follow, and subscribe. We appreciate your time. Thank you for coming.